my name is Rebecca Schaefer. I'm a physician assistant student at Duquesne University, and I'm going to be doing your NGT placement today. Can I confirm your name and date of birth?
Marco Polo, February 2nd, 1998.
Nice to meet you, Marco Polo. So, an NG tube is a nasogastric tube. So this just means I'm going to be placing a small tube through your nose, into the back of your throat, down your esophagus, and into your stomach. I know it's a long journey for this NG tube. So, we're going to make sure that the passageway is clear, and we're going to do this procedure to relieve some of the symptoms you're feeling from a small bowel obstruction. It'll relieve the pressure, and also just give us a way to provide nutrients if necessary later. It's short term, so you won't have it very long, but this is the best procedure for you right now.
Sounds good.
So there are some risks to the procedure. One of them being vomiting. You might feel the need to vomit just because of the procedure going into where your gag reflex is. And it can be just a little uncomfortable, but again, you shouldn't feel it once it's placed. Other complications come with not placing it in the correct spot. So you could get a pneumothorax or other things like that, but we're going to make sure that it's placed in the correct area by doing a chest x-ray once we're done with the procedure.
Okay.
So just some quick questions before we get going. Are you on any medications right now?
No.
And do you have any allergies to medications or latex or adhesives specifically?
Mm-mm.
Okay. And then, again, checking the passageway is good. Do you have any history of facial trauma, trauma to your neck or your abdomen? Any surgeries in those areas?
No.
Okay. And then do you have any history of seizure disorders?
Mm-mm.
And congenital disorders such as choanal or cleft palate, cleft lip?
No.
Okay. All right, so I think that's everything I need to know before we get started. Do you have any questions for me before we begin?
Nope.
Do I have your permission to proceed?
Mm-hmm.
Alrighty. So I'm going to wash my hands and gather all my materials. So this is your cup of water that I'm going to have you sip during the procedure. It will ease the flow of the procedure and make it go by swiftly if you are able to cooperate and take the sips of water when I ask you to. So first I'm going to measure. I have my tape set. Okay. So to measure this, I'm going from the tip of his nose to his ear, and then down to the xiphoid process. I'm going to mark that with my tape. This is just so we know when to stop pushing the tubing down. Okay. And then that's so it goes easier. And then I would also lubricate it. Okay, so I'll have this here in case you need to vomit. And I'm going to have you hold this after I check patency of your nares. So this means I'm just checking how your nostrils are and if the tubing is going to be able to pass through them. So if you tilt your head up. Okay. Looks good. I'm going to be using your right nostril, okay?
Okay.
Alrighty, so you can hold this for me and just sit upright. I'm going to put my hand on the back of your head just to support it, okay? Alright, so I would insert the tubing into his nose unless I feel pressure and have you tilt your head forward and take a small sip of water. Okay, and then keep inserting it. Small sips. You don't have to keep drinking. Thank you. Alright, and then once I reach my tape, I would stop inserting it, and then, yes, if you could hold that for me. I wouldn't have to hold it, but going to this is very complicated. All right, so make sure that's in place, and then I would pin the tubing to his gown. All right, so then I'm going to send him off to chest x-ray to make sure that it's in the correct place. And now for the removal of it. So once you need to have it removed, I'm going to just cover you with a towel, just in case anything is going to spill or get wet. Again, I have the emesis basin and some tissues and gauze here. I will make sure that the suction is turned off before beginning to remove the tubing. And then I would unclip it from his gown and also take the tape off. I'll do that in a moment. And also check for peristalsis before removing it. So I'm going to use the towel just to make it easier to pull out and to just because there will be contents on the tubing. So I'm going to have you take a deep breath in and out, and then I'll remove the tubing, okay? Mm-hmm. Alrighty, so big breath in and out after I remove that. And then I swiftly pull it out. That way. And I would discard it. If there's any blood on it, I would put in the biohazard. Otherwise, it would just be discarded. And so after the removal, you're not going to be eating or drinking anything for 1 to 2 hours. And then for the next 12 to 24 hours, just make sure you're eating soft foods. Also, after I placed it to begin with, I would remind the patient not to be eating or drinking anything, as everything will be coming from the NG tube. And I believe that's it. Thank you so much.
Thank you.